YouTube, how you doing? It's been a while. It's been a chaotic 6 to 8 weeks, but I'm here checking in to make sure you're doing okay, also to update you with what's going on with my journey. If you're new to the channel, welcome. Great to have you here. My name's Nathan Chilton, and if you are already subscribed, welcome back. So this video is going to be a little bit of an update on the lung biopsy. So my last video, link in the description, was leading up to my biopsy the week before. So I want to fill you in how the procedure went, how my recovery's been, and how I've been during the time period from the biopsy waiting for the results. The procedure itself was way more invasive and painful than I expected. And there's a lesson there. If you go in with an expectation and that expectation is not met, or reality doesn't meet up with that expectation, you're setting yourself up for a bit of failure. So I don't know what I was expecting. Obviously I wasn't expecting it to be that uncomfortable, but it was. So I don't know if that made it worse than it actually would have been if I went in with no expectation. However, the procedure itself was a lot more invasive. There were a few more incisions than I thought, and one was slightly bigger than I expected. And then the pain post-op was pretty bad. Where it was, couldn't really lie comfortably on it. Because I'm using a crutch on this left hand, it hindered my walking, which was a huge shame because I was making such good progress from the surgery that I had in January on the bone tumour on the right side of my pelvis. Again, if you're new to the channel, there'll be a link to the video in the description. Because I was making such good progress, it was really frustrating because it was like taking 10 steps back, which was really difficult for me mentally, emotionally, and physically. So I was pretty down in the dumps, finding it very difficult to kind of see the bigger picture, and I had to really focus and just be patient and be grateful for the progress I'd made prior to this, and just be patient, knowing that even though physical pain and discomfort isn't very nice at all, it does pass with time. So I just really focused on that. Easier said than done when it feels like your world's upside down, but it's nothing that I'm new to. So I have got good structures in place, routines in place to help with all that. But we're 6 weeks in now, and other than a slight scab on one of the wounds, everything is healing quite well. Just recently I've had a bit of a chesty cough, so today before filming this video I've just gone to the doctors to check that out, get them to listen to my chest, just to make sure that there's no infection. And in fact it does sound a little bit rustly, so I did think that, so better to be safe than sorry. I've had to go on some antibiotics again, so I need to make sure after this course, which is a 5-day course, that I'll be hitting the probiotics, just to get that gut bacteria back up, because as of late I've had to take quite a lot of antibiotics because we're really trying to prevent infection, especially as I've got so much metal working that in these early stages particularly it's pretty prone to infection. And because it's not my body part, if it does get infected, my body will find it quite difficult to fight off. So that's where we're at with that. The period of time between having the biopsy and waiting for the results seemed like a lifetime, and that just added to the emotional and mental stress that I had been feeling. It just felt like it was all building up. It was relentless. It was one thing after the other. I just needed a break, basically, and I was finding it very difficult to see the bigger picture of life, of all the joy that I have in my life, all the things that I have to be grateful for. So I had to really home in on that gratitude practice, making a conscious effort to write down, journal, think or say out loud what I was grateful for. Because there is so much to be grateful for, even though I'm going through this, but I just felt a bit more down in the dumps than normal. Like I say, it's just relentless at the moment. It feels like it's one curveball after another. But that gratitude practice really did help. And if it's something that you don't implement in your daily self-care routine, I highly recommend it. Particularly when you're going through something that's difficult, whether it be a health issue or any other adversity or obstacle you're facing. But you should always practice these things from a place of ease, because then you really reap the benefits of the practice. Because what I've found is, if it wasn't for my self-care routines at the moment, I would probably have sunk. So at the moment, my self-care routines are just keeping me afloat, which is enough to survive. Not necessarily allowing me to thrive at the moment, but I know when I come out the other end, the lessons that I've learned during this time will allow me to thrive. But when you do your self-care routine in a time of ease, when you aren't dealing with extra stress, it really does help you to thrive. But not only that, when you are then faced with hardships or obstacles, you've got more capacity, you've got more bandwidth. So that's why self-care should be your highest of priority, because it really does give you the tools to tackle life, basically, and just, like I say, give you more capacity for whatever life throws at you. Because I think we all know that life will throw things at you, and if you have got more capacity, you're going to be able to navigate through them a little bit easier and hopefully come out the other end a better person. So I ask myself two questions when facing obstacles or adversity is, what can I learn from this, most importantly, and how can I come out the other side of this a better person? And during this past 5 weeks, when the times were dark and I was really struggling, I just reminded myself of those two questions. They really did help as an anchor to help navigate me through these difficult times. So because my movement was a lot less, I really felt like the progress we were making here with the pelvis was really, really hindered, and that, more than anything, affected me psychologically. So, like I mentioned, the practice of gratitude really helped. So I was really grateful for the progress that I'd made, something that I kept reminding myself. But then I had to remind myself to be patient with the progress that I was about to make. And it was a kind of constant flow between the two that really helped keep me focused. Focused in the present moment, allowing me to keep all my energy on what I was trying to achieve now, which is basically day in, day out, try and be the best version of myself, but not being too hard on myself, something that I'm a nightmare for, and I know it's quite a common thing amongst the human race. But just to really show myself love and compassion while I'm trying to navigate this journey, which, like I've said before, is just relentless. But as much as it's relentless, it's also a beautiful journey. And I was speaking to my partner the other day and I said I'm enjoying the process, and she said, is that the right word? And if I didn't perceive this journey as something that I could enjoy, it would get dark very quickly. And yes, a huge percentage of it I'm not particularly enjoying it, but what I meant by that is I'm enjoying what I'm getting out of it. And that's how you have to perceive adversity or obstacles or any hardships that you're facing. Is if you aren't looking through the lens of what can I take out of this, what joy can I get out of this, it does get dark really quickly. So I think that's what I meant by that, is I'm enjoying the process because I'm looking at the bigger picture, knowing that when I get to the other end of this part of my journey, I will be equipped with more tools, more insights, greater joy for life, a bigger appreciation. So I think that's what I meant by enjoying the process. Obviously no one enjoys physical pain or mental torment or emotional stress, but I think it's because I'm looking at the bigger picture. That is what I meant. And if that makes sense to you, great. It makes sense to me, which I guess is all that matters, but I am trying to inspire and empower you guys, so I hope it helps you too. So the biopsy results were either going to be cancerous or benign. So in my mind, it was either really bad news or bad news. The reason for that is because even if it was benign, there are still so many unknowns and uncertainties coming my way. We did get the results, which were benign, which I am extremely happy about. It took me a few days to settle into that and be grateful for that news. And people's responses of, oh, that's amazing, I'm really happy for you. I understand from their point of view why they would think that. And obviously it is the best news out of the two. But when I hear the word benign, especially knowing that these nodules in my lungs probably can't be operated on, it is going to be a lifelong, possibly limiting problem. We don't know the details at the moment, but as soon as I know, I'll fill you in. is this benign tumour has already caused me a nightmare for the past decade. If it was cancerous, 10 years ago, we would be having a very different conversation here, because it would have been dealt with very differently, would have probably been removed in its entirety back then. So this decade that I would have had would have been very different. That said, I wouldn't change it for the world. I don't regret anything that's happened. Everything that's happened in this past decade has definitely sculpted me and changed me for the better. So I wouldn't regret it. But back to that word benign, in my mind, it might as well be the word cancer. It's probably caused me as much stress, emotionally, mentally, physically, as if it was cancer or not. So at first I was like, great, yes, it's benign, so what? But obviously it's definitely the better news. However, like I said, lots of unknowns and uncertainties. But when it comes to that, I'm pretty good at navigating the unknowns and uncertainties, because I've had to for like I say, the past decade. I'm going to be doing a video or a podcast on unknowns and uncertainties soon, and what I do to help navigate them, with the hope that it helps you guys too. So the biopsy results being benign, at the moment I'm guessing there will be some form of medication, but that's all I know at the moment, and I'm waiting to hear back from the consultant. So I hope you've enjoyed this video. If you have, please do give it a like and a subscribe if you haven't already. If you do know anyone that this video may help, please do share, because the whole purpose of this channel is to help people. And if it just helps one person, it has all been worthwhile. And I look forward to seeing you soon.